In this video, we discuss a scleral fixation technique for an Akreos IOL using a modified four-flanged technique. This video, shared by Dr. Shamil Louaya from Agadir, Morocco, demonstrates a system that facilitates the Canabrava technique for fixing a four-haptic intraocular lens. This patient was a phakic following a complication from cataract surgery and had not previously undergone a vitrectomy. Initially, the surgeon performs paracentesis at 3 and 9 o'clock and places the infusion in the anterior chamber. An anterior vitrectomy is performed, removing vitreous in the anterior chamber, at the level of the pupil, and beyond it. Additionally, the surgeon repositions the superior iris that was incarcerated near the old incision. The Shamil implantation system involves passing 6O-proline sutures through the haptics of the Akreos IOL and positioning them properly in the IOL injector. Note that the surgeon threads the proline through the two proximal haptics first, and then passes the other half of the suture through the two other haptics. Both the first half of the proline, as well as the second, are positioned towards the exit of the injector. It is important to be careful not to confuse the sutures and not to cross them during the technique. A superior corneal incision is made. The surgeon inserts one end of the proximal proline into the cornea, and uses a 30-gauge needle 3 mm from the limbus in the inferior temporal region to externalize it. Then, he uses low-temperature cautery to create a flange. Subsequently, he externalizes the other proximal end of the proline through an inferior nasal sclerotomy, also creating a flange. Note that when looking at the cartridge, it is easy to identify the proximal proline sutures, to avoid crossing the sutures. The choice of tangential points to the cornea serves as a guide for the positioning and symmetry of the sclerotomies. Next, the surgeon injects the IOL into the anterior chamber and prepares for the fixation of the distal haptics. He positions one of the sutures end at the nasal paracentesis first to assist in the insertion of the needle located in the superior temporal region. He then uses a similar maneuver to deliver the other end of the proline, fixing the last superior nasal haptic. Adjusting ocular tonus is important for creating the final flanges in a way that fits well to the sclerotomy, allowing for symmetric fixation of the IOL without tilt and avoiding extrusion of the sutures. The technique employs a standard foldable 4-haptic IOL, utilizing readily available operating room materials such as a 30-gauge needle and 6:0 polypropylene suture for the implant preparation and injection, ensuring accessibility and efficiency in surgical settings.